An estimated 70% of cardiac arrests happen at home, and about half of those don't get the help they need before the ambulance arrives.
That's why the American Heart Association says it's critical for everyone to know what to do in an emergency, including kids.
In today's Health Minute, Mandy Gaither has more on what to teach your kids.
It can happen in an instant. When a person goes into cardiac arrest, time is critical, and many times these emergencies happen at home.
9 out of 10 people will not survive. And that's not because that we don't know what to do for them. It's that oftentimes people don't recognize it soon enough. Oftentimes they don't have CPR performed. They don't have an AED.
Emergency physician Camilla Sasson helped write a statement for the American Heart Association, stressing the importance of everyone, including children as young as 4 years old, to know what to do in an emergency. She says the first thing to know is how to recognize cardiac arrest.
They've suddenly collapsed. They're not breathing normally. Maybe they're gasping for air.
Sasson says even young children should know their address and know to call 911 in an emergency.
We practiced about how to use the phone and tell them, hey, look, this is where I live. I need help.
Sasson says for every minute a person in cardiac arrest doesn't have CPR performed, chances of survival go down by 10%.
Put your other hand on top.
That's why she says older children who have enough strength can even learn this potentially life-saving technique.
I have them practice at home about where is your breastbone? Okay, how would you find that on somebody else? Okay, if you needed to push hard and fast at a rate of 100 to 120 beats per minute, we turn on the radio and we listen to a few songs that we know are at that beat.
Sasson says no one is too young or too old to save a life. For Health Minute, I'm Mandy Gaither.
The American Psychological Association says teens need training before they start using social media. APA President Dr. Thelma Bryant says social media isn't inherently good or bad for young people. However, Bryant says instruction is needed for its safe and healthy use. The recommendation was among 10 of the APA released Tuesday, so there's also recommendations for imposing limitations on content that promotes self-harm, as well as limitations to ensure kids get enough sleep.
The U.S. Department of Agriculture is considering whether chocolate milk should be banned from school cafeterias due to its added sugars. Some say it's contributing to rising levels of childhood obesity. Others argue taking it off the menu will lead to kids drinking less milk, meaning they would lose out on the calcium and other nutrients. The USDA is expected to make a decision the first part of next year.
Despite ramped up vaccine hesitancy during the COVID-19 pandemic, the public still trusts most childhood vaccines. A new survey found 9 out of 10 adults see the benefits of the measles, mumps, and rubella vaccines. The Pew Research Center says that's remained unchanged since before the pandemic. When it comes to the COVID vaccine, only about 60% say the benefits outweigh the risks. The survey also found those who didn't get the COVID vaccine have less positive news on MMR vaccines in general.
Advisors to the Food and Drug Administration voted to grant accelerated approval to an experimental gene therapy. SRP 9001 treats Duchenne muscular dystrophy in a single dose. The problem is it hasn't been clinically proven and the FDA has safety concerns. During a meeting lasting 9 hours, parents told their stories about the therapy keeping their kids walking longer than if they hadn't received it. The advisors voted 8-6 to put the drug on a path to go to market without clinical evidence. The FDA is expected to make a final decision by the end of the month.